If a hospice CEO only had 5 minutes to understand this rule, what are the 3 most important takeaways?
Well, I would say the addendum. Judi said it, October 1, we have 6 weeks to be ready for this. And I talked to a hospice just yesterday, and they haven't even had a meeting yet to think about how they're going to implement it. Others started back in April when the proposed rule came out. So they need to understand the addendum and make sure someone is assigned to be the project leader in their organization to get that going, because it's significant. Every Medicare patient has to get the addendum within the first 5 days of election of the benefit. I saw in some commentary in an online group this week where people were talking about the addendum, and a nurse said, well, isn't that the ABN, the Advanced Beneficiary Notice of Non-Coverage? No, very, very different. And then they were like, well, okay, we have a lot of things we don't pay for, so we're really going to have to think about this. And so those organizations that really haven't tuned in and don't have a clue what this is now that it's mandatory are going to be behind the 8 ball, so to speak, and they're going to have a tougher time. But we really have to stop and think, okay, we have it, as you've talked about already, Chris and Judi, with the tea leaves. The tea leaves are telling us this. Let's just stop and think, how can we strategically, systemically use this information and prepare and position ourselves so that when we get looked at, we're okay. We know that we're going to be in good shape. We may not be there today, but we're putting things in place with our quality improvement processes to be able to get there.
The translation to that is stop whining and get this implemented. Unrelated items, services, and drugs should be exceptional, rare, and unusual.
And in 2024, the non-hospice spending for parts A and B was over $2 billion. Hospice patients had $510 million in cost sharing for parts A and B services billed to Medicare just in 2024. $510 million in cost sharing.
We know that hospices are pushing claims or pushing services over to the Part B side, so that Part B will pay and the hospice doesn't have to pay.
This data is public. CMS has it. It's out there for anyone that wants to go looking for it. And it means that we have to think about, okay, CMS is looking, but who else is looking?
If it is a condition of payment, the last thing you want is to have things on the addendum, the official addendum form, that say, these things are related, but we're not going to pay for them. No. If you're not at the table, you're on the menu. And so I think if we are thinking about how we can position hospice leaders for the future, we want to be at the table.